Hey friends, today I want to talk about freestanding emergency rooms and how they differ from hospital-based emergency rooms and urgent cares. If we've never met before, I'm Dr. Joe Kraft, and this is the take-home message. So I get a lot of questions from people regarding this exact topic. What is a freestanding ER? Well, I've worked at both hospital-based ERs and freestanding ERs, and I can tell you that they're basically the same thing. It's just that it's freestanding. It's not attached to the hospital. But they still have a lot of the same requirements. For example, they still have to be able to see all patients that present. They're open 24/7. They have to be able to do the same kind of things, such as lab work, x-ray, CT scan, ultrasound, all of those same things. And they really are very helpful in decompressing the overloaded ERs associated with hospital-based ERs. So they are very helpful, at least here in the state of Texas, where I've worked at several of the freestanding ERs, and I really like the kind of care that we can render there. So there's a lot of confusion, though, because sometimes people will present to a freestanding ER thinking it's an urgent care. So what's the difference? Well, an urgent care doesn't have to provide the same level of care as an ER. They don't have to see everybody that walks in. They can deny care if you don't have insurance or ability to pay. They have limited hours. They might be open like 8 a.m. to 8 p.m. or something like that. They can't do CT scans or ultrasounds, and they can do limited lab work and sometimes some x-rays as well. It's basically a walk-in clinic because so many of the primary care offices, they don't leave much room for walk-ins anymore. So if you have a primary care doctor but you get acutely ill and you call the office to get an appointment, it might be a week or two before they can get to you. Well, that's not good enough, so they have urgent cares. And if you're sick enough, then you go to the ER. So that's kind of the difference between an ER, a freestanding ER, and an urgent care. The urgent care should be marked urgent care, and it shouldn't say anything like emergency in red letters, where an emergency room at the hospital and a freestanding ER are both going to have, usually in red letters or a red sign with white letters, it should say emergency. So a few questions are, is a freestanding ER more expensive than a hospital-based ER? Because there's a lot of people that think that because they're so much more convenient. But actually they're not. The prices are set by regulations that are regionally dependent. So it should be the same cost as the hospital-based ER. But both of those are going to be more expensive than an urgent care. So be aware of that. Some people get confused because the freestanding ER is not listed as in-network with their insurance company. Just remember, emergency care is not dependent upon in or out of network, okay? Now, if you need an emergency room, you should go to wherever you want to go as far as the closest facility or the best facility and not worry about if it's in or out of network. If by chance you need to be admitted to the hospital, it does make a difference if you're in network or out of network, and that's a completely different ballgame. Here's an interesting situation. Somebody said, I was seen at a freestanding ER and diagnosed with appendicitis and had to send me over to another hospital to get an appendectomy. Is that normal? Well, of course that's normal. That's what we talked about. Freestanding ERs don't have operating rooms in them. They don't have some of the other things that hospitals have. But that's not too different than some community hospitals, right? There's a lot of community hospitals that if you go there and you go to the emergency room at that hospital and you're diagnosed with appendicitis, they would likely transfer you to a regional hospital that has an operating room and a surgeon on call to do the surgery. So kind of similar in that way. And then there's another question about do ERs have to see everybody that walks in? And I addressed that a little bit earlier, but yeah, that's part of the EMTALA regulations that state that if you come into an emergency department, you have to at least have a medical screening exam where they evaluate you to make sure that there's not an emergent condition that requires emergency treatment despite any ability to pay. Now, if they determine that it's not an emergency and it could be seen non-emergently outpatient, then they may be able to deny care for you if you can't pay for it. But they do have to do the medical screening exam. That's the minimum at all emergency departments. And another question that is a little bit more complicated, but it says, can my insurance company deny my ER visit? And unfortunately, yes, they can. If your insurance company determines that you went to the emergency department for something that was clearly non-emergent, they may deny paying it at emergency room rates, which means you could be left with the bill. Most ERs and freestanding ERs are pretty good about telling you that, this might be something that could be done cheaper at an urgent care or someplace else if it doesn't warrant the use of the emergency room. I hope that covers most of your questions regarding freestanding ERs and hospital-based ERs and urgent care. But if there are any other questions, please just drop them in the comments and I'd be happy to get to those shortly. Thanks so much for stopping by. Again, I'm Dr. Joe Kraft, and this is the Take Home Message. Take care.